How we doing, friends? Welcome back again to Male Nurse Mentor. My name is Jesse. If it's your first time here, welcome. Some of you guys are probably on winter break, so congratulations to you. I've got some comments where some people have already graduated their nursing programs. That is awesome. Huge congratulations to you. I mean, the journey continues, friends. It doesn't matter where you are in this journey. Maybe you're trying to get into a program. Maybe you're in it already. Maybe you just finished and you're moving your way right through your career. As for me, I'm 4 years going into the 5th year of my career. This is an ongoing thing. There's a lot to learn along the way, and I'm continuing to learn. As for this video, friends, you guys saw the title. I'm going to be going over my least favorite to my favorite clinical rotations. Maybe some of you guys can relate. Maybe some of you guys are currently in the program and you're looking forward to one of these rotations. Either way, friends, I think this is a good one. So starting off, friends, number 8, labor and delivery / OB rotation. This is my least favorite out of all of them. I made a story about my experience. You can check out that video if you haven't yet already for a deeper look as to why I don't like OB. But just on the surface, friends, OB is going to be a way different rotation for you as a male compared to your female counterparts, right? It's just going to be different. I mean, it's just how it is. You're a man on a female dominated floor. It's already a female dominated profession, but this specifically, L&D, is a female dominated floor. For the most part, that's all I really have to say about it. I just didn't feel like I belonged in that unit. I wasn't welcomed warmly. I wasn't allowed into certain rooms and certain scenarios and certain situations. All understandable. But because of that, you just don't feel wanted, right? That's why it's my least favorite. I also learned the least on that rotation. And it's not, and I guess to be honest, part of it was me, right? Not being interested, but also to feed into that was just not feeling welcomed. So least favorite, friends, L&D, OB by far. Number 7 for me is actually semester 1. Semester 1 is when you do CNA type of work. And you know, for me, as much credit as I give to CNAs, if that was my career, honestly, I probably wouldn't be able to do it. I did go and get CNA certified, but that is about as far as I got. And then when the first semester came along, I was already ahead of the curve. I've already been exposed to everything that a CNA does. I already did CNA work. So first semester is when you do that CNA stuff. So for me, it wasn't anything new, but it's not my favorite thing to do. Yes, you do have to do CNA stuff, right? Help with ADLs and basic care as a nurse. You do have to do that. And it really just depends on the care team, right? And once you get to the workforce, if you're gonna be doing CNA work a lot more or not. Or if you work in the ICU. If you work in the ICU, you often have to do CNA work because those patients are yours. In a way, you almost don't want anybody to touch them but you. But it really just depends on the circumstance. But looking back, friends, my second to least favorite was CNA, just because the type of work that it is, it's challenging, it's hard, it's difficult. And you know, it's just not my cup of tea, to be honest. And that's what I did in semester 1. So I ranked that as my second to least favorite at number 7. And then number 6, friends, right? This is where I have peds. Pediatrics, working with kids, right? Oftentimes, it's like, in theory, it's not that bad, right? You're working with kids, but the idea of that isn't the reality. The reality is you're working with the parents and the family dynamic. And that's a dynamic I'm not a big fan of. It takes a special person to be able to do that, because not only are you working with the kids, but you're mainly working with the parent. And then if you think about it, when the parent is taking their kid to a clinic or a hospital, there's a lot of stress there, right? This is their littlest family member coming in, someone they care about so deeply, and they're sick. And then one thing I realized, in reality, you're not really just caring for the child, you're also caring for the patient's parents, right? The parent, the mom, the dad, they're the ones that are kind of hovering around this, right? Making it more difficult for you. So for me, I wasn't a big fan of that, but also, I don't know if I'll ever even have kids, so being in peds isn't really the setting for me. So for me, that was ranked number 6 on my top 8, right? These 8 rotations, so clearly it's not one that I'm a huge fan of. But if you like kids, you like working in that family dynamic, that might be one you enjoy more than me. But for me, kids, they're cool, but the parents, they add a whole nother dynamic and a whole nother layer to that experience. It's an interesting dynamic. In pediatrics, it's really the only time you get to feel that. Labor and delivery, I felt it a little bit too, because there's a newborn child, right? This new family unit. If it's a newborn baby, you kind of feel the same way. But anyways, friends, that was number 6. So number 5, this is where I put Med-Surg. Med-Surg after semester 1, and maybe at the very end of semester 1, you start to dip your toe into Med-Surg. It's not super specialized specifically in one thing. It's just a very versatile, working rotation. You get exposed to so many different areas of nursing, but it's all just general. Sure, you learn a lot of skills in this setting, but for me, I just didn't really like it. And I think a lot of it stemmed from not really liking the hospital. And when you think of the hospital, you think of general Med-Surg, because the majority of people, they're not in the ICU, they're not in the ER, right, for long extended periods of time. Most people ideally go to the hospital, get treated on a Med-Surg floor. So in semester 1, maybe at the very end, but from that point on, semester 2, semester 3, semester 4, I actually had 5 semesters in my program, but every single one, you do general Med-Surg. And maybe it was just the repetitive act of doing it over and over again that I didn't like it, but I have to dive deeper than that. I think I just wasn't a fan of the hospital, and because of that, I ranked Med-Surg as my number 5, least favorite. And then next on this list, friends, I put ICU as number 4, right? This is now moving into, a little bit more of my favorites. ICU is a really cool rotation, but it's also very intimidating. There's a lot of lines on these patients, a lot of medications going on at the same time. Some of them may contradict. Everything is a lot higher stakes in the ICU. A lot more stress, a lot more tension. These patients are critically sick. I mean, if they're not in the ICU, they're likely to decline very quickly and ultimately pass away. So the ICU is, high stakes, high stress. That's why oftentimes these nurses, when you're a nurse in this rotation, you'll see you only get 1 to 2 patients. Sometimes maybe 3, it really just depends, but at max, from what I've seen, it's around 2, like on average, right? And you pretty much do everything for these patients. Like I mentioned earlier, you even do kind of CNA type work for these patients. And a lot of it goes to, as an ICU nurse, you don't want anybody to touch your patient, right? You're just hovering them. They're critically sick. Everything that you do or don't do can really reflect on this patient's outcome. ICU for me was a really cool experience. I just don't know if I wanted to work in a hospital or at that acuity level, if that makes sense. If there was like a second replicated version of me that was more into the clinical aspect of nursing, ICU would probably be a place that I would like to work. You would learn a lot, you have 2 patients, you do everything for them, but it's like a different pace, way different pace from Med-Surg, ER. It's really unique, really, really cool, but I can also imagine how burnout can happen there, because the stakes are higher. You do a lot more for these patients, and family members are probably a lot more panicked and stressed out when you do happen to see them. So there's other things involved, but this is now going into my favorites, and I put it at number 4 on this scale here. Next was public health. Public health, I have it at number 3. I think I have it this high because of the type of nursing that I'm into. I don't mind desk type nursing jobs. Public health can bore, the absolute everything out of people, and I get it. When I was first doing it, I was like, man, this is so different. Like, I'm in an office setting, working at a local county. This is public health. Like, yeah, we're looking at all these things that we could do for the community, and it was just such a different pace. I worked in a cubicle, had my desk, my computer. I dressed different. I had to dress more formal, and it was a way different pace. When I was in nursing school, I almost feel like I didn't appreciate it enough. Now that I've been working in the workforce for a bit, I could see myself doing some type of job like that. Maybe not in public health, but some type of nurse consulting type position, right? Where you're still a nurse, you still have nursing knowledge, you just apply it in a whole different way, right? Public health, you don't apply it to just one patient, you apply it to the community. You look at a community's outcome, a patient population outcome, and that's like a different type of mindset, right? When you go into public health. Sometimes it is one person, but oftentimes it's population based. And it's a cool experience, a really cool exposure. I do remember that rotation being one of my favorites just because it was so different. And every time I walked in, I felt like I'm not going to a hospital, like that's a plus. And then number 2, friends, number 2, I have ER. ER, like I said, if I lived a different life and I knew I liked nursing for the clinical aspect of it, ICU would be more interesting, and ER would definitely be a setting I would work in. I did enjoy my time in ER. I had a few experiences working there on my rotations, and it was a cool experience in the sense that you see patients pretty quickly, right? Everything is like acute. and then you kind of push them along through, right? You push them to someone else. You push them to the people in med surg. But it's a really cool experience. You see a lot, you do a lot, you're on your feet a lot, and it's quick. It is quick paced. But because of that, time goes quickly, and there's other benefits to it, right? Like I said, you don't have to be with these patients for a long period of time. When you're in med surg, you're with these patients for a longer period of time. And some people like being with the patients longer. For me, it's not that I don't like patient interaction. I guess part of me doesn't like patient interaction, but it's not like I hate it, right? It's not like I became a nurse and I hate patient interaction. I do like it in certain settings, but med surg isn't a setting that I like. L&D isn't one I like. ER, you're with this patient for a bit, and then you're with this patient for a bit, and you just push them along through. And oftentimes you see your intervention like resolve patients' issues pretty quickly sometimes. That's a pretty cool thing to see. People come in panicked, you treat them, you help treat them, right, with the assistance of doctors, and they get better. And it's a really cool thing to see. People are really thankful there, right? You see people in high stress, and then you kind of do things to lower that for them. And it's a really cool place to work, but it is high strung, high stress, quick, on your feet a lot. But like I said, if I lived a different life, if I was more of a clinical nurse, I would work the ER, but I'm not. And then as for number one, friends, my most favorite rotation of nursing school is psych. It was psych. It still continues to be psych. It was psych at that time. I was very interested in this rotation. Part of my rotation was at an Alzheimer's home, inpatient mental health and outpatient mental health. And again, I think I liked it a lot because it wasn't a hospital, which kind of goes hand to hand into my interests, right? But at the same time, I'm very interested in the psyche, the mental health aspect of a person, right? Oftentimes that part is neglected, it's forgotten about, and it's not treated the same. I know in nursing, we talk about holistic approach, right? And oftentimes we still to this day really just think about, physiologically what is wrong with someone versus what is also mentally going on with somebody. Mental health is definitely very important, not just in the nursing field, but in life in general. And still to this day, it continues to kind of fall below the pace of medical. Like most people don't think of mental health. So for me, doing that rotation, I saw a lot of that still kind of going on. But it was always a rotation that was interesting. I always found it fascinating, just dealing with the psyche in general. And like I said, I did an inpatient, outpatient mental health unit, and then the Alzheimer's unit as well. And that one was life-changing to me. Just saying that people, how dementia impacts a person and their family, it's very sad, but it's like, that is life, So for me, psych was definitely my most favorite rotation by far. In that rotation, I really learned the difference between listening and hearing. Hearing is something we just do often, but to actually listen to somebody is a very special skill. And it's one that I started to just learn in that rotation. And it goes a long way, not in just psych nursing, but in life. But that's it, friends. Maybe some of you guys can relate to some of these. I'm curious. Leave a comment down below if you want to share. What is your most favorite or your least favorite nursing rotation in nursing school? Leave it down below. Maybe you have other people that can relate to you. I'm interested to see. I'm curious. I want to know. I'll see you guys on the next one, friends. As always, I'll continue to be here. If you have any questions, leave a comment down below. Shoot a DM on Instagram. I'm always here.